If you're looking for that elusive cure for tinnitus, then you're watching the right video. Hey guys, Cliff Olson, Doctor of Audiology and co-founder of Modern Tinnitus, and in this video, I'm talking about 3 different miracle cures for tinnitus. One thing that everybody knows about people with tinnitus is that you're willing to try anything to get that ringing and buzzing sound in your head to stop, including some things that may be a little bit weird, but you're willing to give them a shot if there's even a small chance that they would work for you. I know because I have personally tried a variety of different things with mixed results. Of course, knowing this, there is no limit to the amount of things that people will promote as a miracle cure for your tinnitus. That's why I want to discuss the top 3 miracle cures for tinnitus and one thing that they all have in common. But before I do me a huge favor and hit the like button. It really helps out the channel because it gets these videos in front of a broader audience. And while you're at it, if you have not yet hit that subscribe button with notification bell, go ahead and do that as well. It is greatly appreciated. And a huge shout out to Neuromodulation for sponsoring today's video, but more on them in a little bit. Also, let me know what things that you have done to try and treat your tinnitus and whether or not they worked or didn't work down in the comment section. The first miracle cure for tinnitus has to be Lipoflavonoid. Lipoflavonoid is an oral supplement that contains lemon bioflavonoids and other nutrients to help support inner ear health. These ingredients include vitamin C, vitamin B1, vitamin B2, niacin, vitamin B6, vitamin B12, pantothenic acid, calcium, and their proprietary lemon bioflavonoid complex. According to the company that sells Lipoflavonoid, the combination of these ingredients support ear health. As far as how they work, well, according to the website, vitamins B and C, along with high-potency ingredients, are important to the functionality of the inner ear. Eryodictyl glycoside in the bioflavonoid can improve microcirculation and prevent fatty deposits in the inner ear. Hesperetin, a derivative of eryodictyl, can prevent neurodegenerative diseases by reversing the factors that cause them, and its ability to inhibit apoptotic cell death makes hesperetin a promising drug for preventing and treating neurodegenerative conditions. B vitamins are essential for maintaining a healthy nervous system and supporting inner ear neurons. B vitamins act as coenzymes and protects nerves from damage, contributing to the transmission of auditory signals to the brain. Even without a proven deficiency, they can improve certain neurological conditions. Therefore, B vitamins are crucial for providing neurological support and protecting the nerves that send neural impulses to the brainstem. And clinical research has noted that deficiency of vitamin B12 in patients with tinnitus. Chances are, if you're looking for a treatment option to cure your tinnitus, Lipoflavonoid is probably one of the first ones that you've stumbled across. The second miracle cure for tinnitus are eardrops like Ring Relief. Ring Relief is a homeopathic product designed to provide temporary relief of ringing, buzzing, roaring, pounding, and discomfort. It is the #1 eardrop for tinnitus symptoms and can be easily found online and in local stores like Walmart. It is made with 100% natural active ingredients, including arnica and a whole variety of different ingredients that I cannot pronounce. According to the company that sells Ring Relief, it works via the traditional homeopathic mode of action, which is that they utilize small amounts of ingredients which would cause in large dose ringing, buzzing, clicking, and other unexplained and irritating noises. In a microdilution, however, they gently stimulate the immune system to respond and eliminate the symptoms. As far as their effectiveness, every individual is different and results will vary from person to person. While it will not work for everyone, they do have a 70% rate of positive results and it can take up to 60 days to work. Now, the third miracle cure for tinnitus is spoon tapping. Now, I know this one seems crazy, but just hear me out. According to chiropractic Dr. Alan Mendel, using spoons to tap on the occipital area of your head in a particular rhythm can create physical vibrations and acoustic stimuli that can reduce the perception of tinnitus. He doesn't really explain how or why spoon tapping works, but he does claim that it is an older method that has worked for a lot of people. I couldn't find any research or supporting information that would indicate that this is an effective form of tinnitus treatment, but the best part is it is completely free as long as you have 2 spoons in your kitchen that you can use. Now, before you start looking at me like I'm crazy, there is one thing that all of these miracle cures have in common. Do you know what it is? It's that none of them are backed by actual research. You see, all three of these Miracle Tinnitus Cures claim that they can reduce your perception of tinnitus, but none of them have any actual solid evidence to prove that that's the case. In a search of the research literature for Lipoflavonoid, there were limited results where the majority of them indicated no benefit in the reduction of tinnitus, and the few studies that did were so poorly controlled that no reasonable individual would consider the results valid. On top of that, there were exactly 0 search results that I could find for any literature looking at the effectiveness of tinnitus eardrops to reduce tinnitus. And shocker, I know, but the same was true for spoon tapping. However, there is one tinnitus treatment that is called bimodal neuromodulation that is supported by a growing body of research thanks to Neuromod, today's video sponsor. Neuromod Devices is a global medical technology company that was founded to establish bimodal neuromodulation as the new standard of care for tinnitus. The linear tinnitus treatment device developed by Neuromod combines customized sound therapy to stimulate the auditory pathway and tongue stimulation to stimulate the somatosensory pathway to reduce your brain's attention and sensitivity to tinnitus sounds. And while it may seem that this is just as quirky as tapping spoons on your head, the growing body of evidence not only indicates that this is a legitimate tinnitus treatment option, but it could be the most effective tinnitus treatment option that we have ever seen. In 3 separate large-scale clinical trials, bimodal neuromodulation using the linear tinnitus treatment device has had extremely impressive results. In the TENT-A1 clinical trial, out of 326 participants, 86.2% of treatment-compliant participants saw a reduction in tinnitus symptoms after 12 weeks, and 80.1% reported a reduction that lasted for at least 12 months. In the TENT-A2 clinical trial, out of 191 participants, an impressive 95% of treatment-compliant participants saw a reduction in tinnitus symptoms, and 91% reported a reduction that sustained for at least 12 months. Both were impressive results, to say the least. And in the TENT-A3 clinical trial, out of 112 participants, 70.5% of treatment-compliant participants saw an impressive reduction in tinnitus using bimodal neuromodulation, when sound therapy alone provided no meaningful benefit. And keep in mind that this was just after 6 weeks of using the linear tinnitus device, when the average duration is 12 weeks. And to top it all off, a recent review of Linear's real-world effectiveness demonstrated that 91.5% of Linear patients at Alaska Hearing and Tinnitus had a clinically meaningful reduction in tinnitus after 12 weeks of Linear use. This real-world data is consistent with, and in many cases outperforms, Linear's clinical trial data. Not only has this peer-reviewed research yielded significant evidence in favor of the safety and effectiveness of using bimodal neuromodulation for tinnitus, but it has also led to the FDA granting de novo approval to the Linear tinnitus treatment device as the first device in a brand new category of tinnitus treatment, and it is even recognized by the American Tinnitus Association. So if you have tinnitus and you're looking for a treatment option that is actually backed by research, I highly recommend that you go to linear.com and find a hearing care professional who uses bimodal neuromodulation to treat tinnitus. When it comes to searching for Miracle Tinnitus Cures, there's really no harm in trying a variety of different treatment options as long as they don't have any negative side effects. Just don't get discouraged if they do not work for you. After all, even medical treatments that have been proven to be effective by science aren't effective for everybody. However, the likelihood that a tinnitus treatment will actually be effective is significantly higher if that treatment has undergone the rigors and scrutiny of controlled peer-reviewed research. Now, if you ask me, there are 3 guarantees in life: death, taxes, and the promises of new Miracle Tinnitus Cures. So do yourself a favor, schedule an appointment with a hearing care professional that specializes in tinnitus treatment and find out which research-backed tinnitus treatment options might be right for you.